I can go over this with you again afterwards, but so the SMA is, this is like a front view. You have your aorta that comes down, and the SMA stands for superior mesenteric artery. It's this artery that comes out from the aorta and drops down and gives blood to organs in the abdomen. This is your stomach up here, and then your small intestine kind of goes out this way and then tucks back underneath that artery. So if you're looking at it from the side view, the stomach would be up here, it would go this way into the wall, kind of come back out, and this is what we're looking at, and this is the SMA right here, okay? So what that does is whenever she loses weight, there's a fat pad that sits between this artery and your aorta that keeps this from compressing on that valve. And whenever you lose a lot of weight and that fat pad goes away, that angle closes down and it starts to squeeze down on the duodenum. So what that does is food can go down in here, it can be digested in the stomach, starts going down, and then boom, gets stuck right here. Doesn't go any further. That's why she's throwing back up. That's why anything that we give her by mouth isn't really going to be much help, because it's not making it where we need to be, because the contrast is sitting all the way down here in the large valve.
So at what point are we gonna, like, the doctor needs to order nutrients, because she needs food. She can't just be on sugar, water, and electrolytes.
Exactly. So that's where I'm gonna have to get back to you on the specific plans. I know that we were waiting on the enema to see the X-ray to then get the CT. So I'm not sure exactly where we're at with doing the nutrition and all that right now, but I will get that information and get back to you. But that's why anything by mouth isn't going to be helpful.
What's the doctor right now on duty?
Yeah, he's still here right now. McMuffle's probably.
I know Dr. Adamson is.
He's in clinic.
He was on call. So this is on call tonight.
Okay.
It's not yet, but I haven't seen Dr. McMuffle.
Dr. McMuffle was the one that was here with us this morning.
From this morning.
And
Okay.
if we can find
that
her,
out for you.
yeah.
Okay?
But if not, Dr. Adamson, I'm not sure if you met him yet. He's on call tonight, so he'll likely you staying here tonight. Yeah, so he'll likely come around and talk to you a little bit later on today. Give you a little bit more of the plan that we're going.
So let me ask you this. So
Yes.
she was throwing up before she lost all this weight.
Mhm.
So what caused that?
Number of different things. So how long ago did she start throwing up?
January 7th.
January 7th, okay. So it could be that this was kind of starting to happen, which causes the vomiting, which then causes the weight to be, it's like cycle, keeps making it worse. Or it could have been something that,
So she's got something going on with, what's the other thing with her throat?
She's a hyperthyroidism.
Hyperthyroidism. So that could have
and that
caused
can
lost
cause-
weight?
That can cause weight loss as well. So
That can cause vomiting, the thyroid storm.
It can, yeah.
Thyrotoxin, I don't know.
Yeah. So that's where it's trying to point the finger at what the initial cause was. It isn't necessarily the most helpful at this point.
Right.
So we don't know for sure 100% if it's SMA.
Correct. That's why we're going to get the CT. Now, looking at the imaging, it looks very, very familiar for SMA syndrome. So the question would be, did the vomiting cause her to lose weight, which led to SMA syndrome, which is now exacerbating the situation, or was the SMA syndrome there all the time, and it's just now kind of getting worse? Because it's one of those things that once you stop eating, you're exactly right. You're not getting nutrition, you start losing more weight. It does take some time to build that weight back on.
So do they do nutrients through her IV? Can they do that?
It would be through,
That would be something that could be done, but usually before we do that, we would do a tube that goes past where that obstruction is. We had another patient where we did that, and we started giving her a liquid, like nutrients, that went down the tube, past the obstruction, and that way she could get the nutrients she needed.
so that's likely the next step.
And how long do you have to be on that for?
Until she gains weight, or it gains enough weight to lift that artery off, so that way you no longer need that tube to get the food. Because what that would do is kind of through the nose, up, down the back of the throat, and then into the stomach, down, and then push past this area, and then we're letting the food out somewhere down here. So that way she can absorb all that nutrients. That should then bring this fat pad up, open that up a little bit, open this up. That way when she can start swallowing things, keeping them down without vomiting, and then she can eat on her own to gain a little bit more weight back.
She would be, after the tube is placed, you know, if we do this tube, after the tube is placed, she would be, you know, up talking to you, she would be able to. As soon as she would just have a tube down her nose, which is
Okay.
uncomfortable, but she would still be awake and everything.
Who would do that?
That's something that radiology would do.
Okay.
Yeah,
That's
so
not the surgeon that's gonna do that.
I believe it's radiology that does that.
Radiology does the NG tube?
Surgery might do that, I'm not sure.
Get you that information too. 'Cause I have not personally seen one of those done yet.
Are there risks to that?
There are risks because it does involve anesthesia. So anything that involves anesthesia has the same.
I'm saying like going down.
Not really, because you're just going down the same pathway that food would normally go
Oh,
down,
okay.
and you're
When they
going.
do any procedure,
Okay.
but
Yeah,
they'll
you're
go
not-
at every risk to you to make sure you're
Okay.
well educated on it.
And you're
I
not
won't do
poking.
anything with that.
Okay.
Yeah, and as far as an NG tube goes, you're not poking through anything. You're not. It's going. It's up your nose, down your throat, and then the regular path that food would go. The reason why you go up the nose is just a little more comfortable in having
How
that.
long does it take to gain weight with something like that? We're
That
talking
would
about,
depend
like,
on her.
weeks?
So we don't need to see her gain a bunch of weight. We just need to see the weight start to come back and to the point where she can eat and keep things down.
Okay.
That kind of depends on her, and we can get a little bit better of a clinical picture after we get that CT.
Okay.
Okay.
So
All I
we're
can
waiting
do.
to find out if the CT, if we can do the CT scan.
Correct. That's something I'm going to go
When we can do
find
the
out
CT
right now because, like I said, the concern with that would be